This video shall give you a basic knowledge about the most commonly used MRI sequences. I don't want to talk so much about the technical details, but instead focus on how to recognize a certain sequence and also what information this sequence can give you regarding image interpretation. Here you see a T1 weighted image. The most important feature that characterizes a T1 image compared to a T2 image is that water appears dark or hypointense, as you say with MRI imaging. So here on this image, the cerebrospinal fluid is dark because it consists mostly out of water. Also, an edema or most cerebral lesions appear dark on T1. Black on T1 would be air in the nasal sinuses, dense bone like the skull, and calcium like in calcified lesions. Gray on T1 is a white as well as gray matter, the latter being faintly darker than the former. Bright or hyperintense objects, on the other hand, are fat-containing structures, as seen here with the subcutaneous fat. Also, a subacute hemorrhage appears bright. After contrast application, all vascularized structures also appear bright. You can recognize a T1 image because basically it looks like a CT scan with the ventricles being dark, whereas the skull is bright. In contrast to a CT scan are the orbit which contain fat also bright, whereas the globes consisting mostly out of water content are black. Vessels are normally not seen on T1 image without contrast application, so that in order to see normal vessels as well as vascular changes or disruptions of the blood-brain barrier, it is useful to give IV contrast agent. The contrast agent used with MRI imaging is gadolinium, a rare earth metal. So the contrast-enhanced T1 image looks like a non-contrast T1 weighted image, but with the bright arteries and veins. It is important to note that not every structure that is bright on a contrast-enhanced T1 image is a vessel or a hypovascular structure, as fat-containing lesions or subacute hemorrhage already appears bright on a native T1 image. So it is always important to compare these two images or to look at a subtraction image, as you see here. As already mentioned, the most important feature that differentiates a T2 image from a T1 is that water appears bright, as seen here with the cerebrospinal fluid. What else appears bright on T2? This would be a hyperacute or late subacute hemorrhage, an edema, as well as most pathologic lesions. Also, fat appears bright, so that if you see a structure that is bright on both T2 as well as T1, you can tell that it is either a fat-containing lesion or a late subacute hemorrhage. In order to differentiate fat or a subacute hemorrhage, you have two options. You can either choose a fat-saturated sequence so that if the lesion contains fat, it becomes dark, or you choose a blood-sensitive sequence, which is either a so-called T2 star image or SWI, which stands for susceptibility-weighted imaging. On either of the last two mentioned sequences, a subacute hemorrhage would show a black periphery and an heterogeneous iso or hypointense center. Here you see a T2 star weighted image. The blood is really dark or almost black on this image, compared to a T1 where the blood is bright and the T2 where there is a mixed dark and bright lesion. So again, referring to the T2 weighted image, you also see dark objects like the gray and white matter, where the white matter appears a bit darker than the gray matter. Black on T2 is again air, dense bone or calcified lesions. Same as with T2 image. Another structure that is black on T2 are the vessels, because the fast-flowing blood don't give signals. This is also called flow void. So you can recognize a T2 weighted image by the bright cerebrospinal fluid as well as bright scalp and eyes. The vessels appear black. Once again, speaking of the T2 star or SWI imaging, it is important to note that all structures that contain iron or calcium appear dark, which would be blood as well as bone or calcified lesions, as well as structures with iron deposition. Look for an all dark appearing image to recognize a T2 star image. This lecture continues in a second video, Basic Sequences Part 2.